And while you were working at Odessa, as well as I feel like we did mention, but you were working on Black Health throughout this entire time. But we'll
Yes.
come back to Black Health in a little bit. You also hold the role as Director of Programs at Health Design ED. So tell us about that.
Yeah, so Health Design ED at Emory University in the School of Medicine is an innovation center looking to bring new technologies into the emergency department, right? So, some of the common issues that we see when people are seeking healthcare in general, that when they land in the emergency department, is usually because they don't know where to go to receive care, right? So, I know if I go to the ED, they'll treat me. They give me a bill that I may or may not need to pay or have to pay. And so we just see a lot of overutilization of the ED, which prevents triage issues when there's real emergencies, right? And so, the problem that we're trying to solve is like, how do we provide frictionless care to people so that, you sitting at home, you say, hey, I'm not feeling well. This may or may not be an emergency. Can I use some form of technology to understand if I need to go? So, you're thinking about potentially a triage tool that you can access from your phone or from your computer if you have access to the internet. So, really, just trying to think through creative new ways to solve some of the issues that exist in the emergency department, specifically at Emory, but also, really leveraging a community-focused lens for that work as well. So, we're really trying to solve patient issues and community issues, along the way, we'll probably make the physician life easier as well and provide, new models for physician engagement. But a lot of the work is, how do we create again, frictionless care for people in the Emory ecosystem.
Okay. Yeah, definitely. We know there are a lot of issues with overuse of emergency rooms, especially with populations that are underinsured, uninsured, or low SES.
Yep.
So yeah, that's definitely some cool work that you're doing
Yeah,
there.
and I learned that I say this in the right way. I think that hospitals could be much better. And so, I mean, I used to say that I hate hospitals, I don't like hospitals, but I think the fact is that so much of our care and our healthcare is central, so much of our health is centralized in this building that is a hospital. But what we know as public health folks is that it's everything that happens outside that leads a person into the hospital that we need to be solving for. So, having this experience working within the healthcare system has really been illuminating. But I think it really showed me that my passion is not for what happens inside the walls of the hospital. It's for everything that happens outside.
Yeah. I share very similar sentiments, and I think like the fact of the matter is like hospitals, health systems aren't going anywhere. So it's how can we position ourselves to utilize how they work to better save communities. And yes, there's a lot to be done, but I think it's exciting that there's that opportunity to create better, more sustained community change.
Exactly. Well said.